Some mothers will have made a choice to feed their baby on artificial formula, having understood the risks associated with formula. Our care for mothers who have chosen different ways to feed their babies often appears to be similar, because some of the things we talk about are good for the baby, no matter how you feed the baby. For example, it's very beneficial for a baby to have unlimited skin-to-skin time with their parents. There are 4 important facts to understand about caring for a baby being fed on formula. 1 is skin to skin, and it's so important. It's good for baby's temperature control, breathing, and very relaxing. It helps with bonding and releasing feel-good hormones in both the baby and parent. We advise skin to skin at delivery and for as long as possible afterwards, and as often as possible. Number 2, baby-led feeding is important as it allows baby to determine if they want to feed a little more frequently and if they want smaller amounts. So it's good to look for feeding cues before the feed, which tell you they want to feed, and watch them during the feed, as they can let you know if they've had enough. They may want to feed more frequently than you imagine, and they may want a lot less in a feed than you thought. Number 3, paced feeding means sitting the baby up a little and holding the bottle more level so that gravity is not making the milk flow faster, with the baby unable to tell you when they've had enough. Number 4, the 4th fact, involves making up feeds correctly and safely. As formula does not contain any of the protective factors that breast milk does, it needs to be made up carefully and cannot be kept for very long. Each bottle of formula, if using powder, must be made up freshly for that feed. The water must have been boiled freshly and been allowed to only drop to 70 degrees, which is about 15 minutes and should still be steaming, when formula is then added. The water needs to be this hot to ensure it kills any pathogens in the dried formula powder. Once the feed is partially consumed, the remainder must be thrown away. Feeding babies on formula can seem easy, but there is a lot to think about with the correct preparation of formula. Please think carefully before introducing formula when you want to breastfeed your baby, and please ask for help if you're having difficulties. There is help on the postnatal ward, the community staff can help, and there are troubleshooting clinics for mothers to come to for additional support. There is a national breastfeeding phone line. The Best Beginnings website and the UNICEF Baby Friendly site have great clips and invaluable information which cover breastfeeding, bottle feeding with express breast milk, and bottle feeding with formula. Enjoy your baby, and thank you for listening.